I'd like to talk to you about something that is very near to my heart, and that's hepatitis C. Now, these days are glorious times for hepatitis C. We finally have excellent treatments that are safe, well tolerated, easily administered, short duration, with cure rates that approach 95 to 100% for most people. This is in stark contrast to what we had to offer people living with hepatitis C only a couple of years ago, when treatments were difficult to take and many people had contraindications to therapy. Furthermore, the cure rates were below 50% for most people living with hepatitis C in Canada. So these are great days, and in my clinic, every day people are benefiting from these new treatments. They're initiating therapy, taking it for as short as 8 to 12 weeks, and achieving cure rates of 95% plus. Every day we're telling people that they don't have to live with the stigma and the fear of the disease and fear of the illnesses that hepatitis C can produce, like liver cancer, liver failure, and the need for transplantation. So, we should be happy, but unfortunately our work is not done. It seems like an obvious statement that if one is able to initiate and benefit from these therapies, they must first be diagnosed. But we currently have no national strategy for screening. We know that screening is an important and first step in identifying patients and getting them engaged into care. And without a national screening program, many people will be destined to never be identified until they've already progressed to end-stage liver disease, when in many cases it's too late to benefit from these new therapies. The United States has recommended that we screen all baby boomers. The Canadian Liver Foundation also has strongly endorsed this guideline. Why is this important? Because it normalizes testing. It says it's okay for everyone to be tested for hepatitis C, instead of just focusing on individuals who have participated in high-risk behaviors in the past. Focusing on high-risk behaviors increases the stigma related to hepatitis C. It doesn't reduce it. Normalization of screening will ensure that the 50 to 60% of people in Canada who have not been identified as having hepatitis C infection can be engaged in care. By having a national strategy for screening, for expanding our capacity to offer therapy, and for providing universal funding for hepatitis C treatment, we can ensure that no person living with hepatitis C in Canada needs to live with the stigma of chronic hepatitis C infection or the fear of eventually going on to die from liver cancer, liver failure, or the need for transplantation. These new treatments are here today. Let's work together to ensure that everyone benefits from these marvelous new developments in treatment.